Mandatory masking rules for schools and other indoor places are ending in several states.
The governors of Connecticut, Delaware, and New Jersey have all said they will end mask mandates in schools over the coming weeks. Officials in Oregon also announced they are lifting general mask requirements for all indoor public places and schools by March 31st. In California, the statewide indoor mask requirement will end as soon as February 15th, but only for vaccinated individuals.
These changes come as the COVID-19 infection rate in the U.S. falls by more than 2/3 from its peak just weeks ago. Despite the decline, the country continues to report more than 1.8 million new cases per week and 2,500 deaths each day.
Joining us now is Dr. William Schaffner. He's a professor of preventative medicine in the Department of Health Policy for the Vanderbilt University Medical Center, always a mouthful, and he is also a professor of medicine for its Division of Infectious Diseases. Dr. Schaffner, thanks for joining us. As you just heard, Oregon, New Jersey, Delaware, Connecticut have all announced they're relinquishing their mask mandates in schools. Can you explain why these decisions are likely being made now as opposed to a month or two ago?
Well, Jerika, it's probably a combination of a number of things. It's their local conditions. They're looking at their local data, and they're getting an awful lot of pressure because there's vaccine fatigue out there. There's COVID fatigue. People are eager to take off their masks. I'm not one of them. I think we have to be careful. We don't want to impair the program before we impair the virus.
So, Doctor, I just want to get something straight, because a lot of parents have this question that if you personally had a child in school, would you send them to school without a mask?
No, I would not. Not at this point. Certainly not in my state. My state is a very under-vaccinated state. And although our cases and our hospitalizations are starting to go down, I'd like to see that in a really sustained fashion over a period of 4 to 6 to 8 weeks before we relax what it is that we're doing to impair the transmission of this virus and put down this layer of personal protection. So I think we ought to stay the course and not try to raise the mission accomplished banner too soon. We've done that before.
Yeah, doctor, and I'm sure there will be parents that make a decision to have their kids masked despite the mandates. Unlike the other state officials, the governor of California is only ending indoor mask requirements for people who are vaccinated. What do you make of that policy?
I think it complicates things a little bit because it provides distinctions within the classroom. I think you ought to do it all one way. And let's keep the masks on for a period of time until we're really rather secure that this downswing is sustained and it looks as though it's going to keep on throughout the summer. Then I would be comfortable in taking the masks off all the children.
It's interesting. We seem to have reached a point where medical advice is diverging from what our sort of municipal leaders are telling us it's safe to do. So it's really important to keep yourself educated right now. Doctor, COVID-19 infection rates continue to decline, as we've been saying. But, you know, we saw that trend shortly before the Omicron variant emerged. And to take a lesson from history that we talked about on the show before, we saw that trend with the 1918 flu, right? Everyone is tired of it. And then the rates actually still go up after all the regulations have been loosened, right? So how are experts like yourselves bracing themselves or concerned about another possible strain of the virus that could potentially disrupt the country again?
Well, Tanya, you see my fingers are crossed. We're all worried about that because the variants of concern, of course, have originated from abroad and then have come here. And there's still an awful lot of transmission that's going on around the world. So I've been faked out twice. Along came Delta and then along came Omicron. But at the moment, knock wood, there's no variant of concern out there currently. But we have to keep surveillance. And that's why under the WHO guidance, we're doing that around the world every day, 24 hours a day.
Yeah, sadly, we are really at this place where we are learning to live with something that we could have never even imagined in our lifetime.
So
Dr.
true.
William Schaffner, thank you.
Thanks so much.
Thank you.